Yeah, thank you so much for staying until the last presentation today. I promise to keep it short as well. So yeah, this social assistance program was one deployed during COVID-19 by the government of Colombia. I currently work in the government, but I did this study before, so the views I'm presenting here do not represent my employer. This study, the motivation we start this study was we not especially focused on how to target as we saw in the previous studies, but it end up involving this kind of questions. We also have the questions of whether giving cash or giving food assistance. This is also a debate in policy in this space, of course. But during COVID-19, we also have like two kind of policy goals. First, of course, alleviate economic hardship, but also at the moment, of course, contain COVID-19 expansion. In Colombia, we do have, like compared to what I have seen in this session, we in Colombia and in Latin America, we have a strong system for targeting poor population for social programs. We have mean test systems in place. So those were in place during at this time. But at the moment, as I was saying, you can think about whether giving cash. A lot of people were under the conditional cash transfer program and other social assistance programs, but you can think about whether receiving cash during COVID-19 was really useful or will help families at the moment, because of course low-income families at the end cannot afford to stay at home for long periods. But the government at the time, or the society, people need to stay at home for COVID-19 to mitigate the COVID-19 expansion, right? So all of this comes together to say delivery of aid at this time matters a lot. The type of delivery, whether it was cash. At the moment, the debate was, of course, is this cash going to be delivered? The person needs to go to a bank or needs to receive this money in their funds, right? So this project is also about, delivery matters. In this case, receiving food in your home matters a lot in this context. So this program was a food assistance program delivered very early in the pandemic, like the four first months, the critical months where lockdown and restrictions were in place, where there were no vaccines or whatsoever. So at that time, this program gave one-time delivery of grocery package. And was targeted to households with no cash support. So this means these are not the poorest of the poorest, because they were already covered by cash transfers. But the government at the time, they thought about, okay, we want to cover also this vulnerable population, the households that are at risk of falling into poverty, especially during COVID-19. And I think that is on the spirit of South Africa as well. Like, you were trying to target this range of households that are not extremely poor, but we believe that because of restrictions at the moment, they were at high risk of falling into poverty. So those were the target of this program. So what they did is that they used administrative data that were in place, to target effectively. Here is the targeting. So they tried to target households that were ineligible for the current cash assistance programs at the time, but were like right above this limit of being covered. To that, the Colombian government used the Census of the Poor and Vulnerable Populations, which is a survey that uses proximity test, and they assembled together other administrative records to try to say, okay, this household is precisely not included in any other program at the time. So they are really these households that are just above this, let's say, threshold of not being beneficiaries before, but now that we consider them at risk. So what we do in this study is use this administrative data, but also we use even the deliveries geocoded, and we have even the exact date where they were delivered, when they were delivered between those 4 months. And we also had access to data on mobility at the time from mobile phone tracking. So at the time, these were a really popular data, like how we can track is whether people is moving or not, is going to which places, and whether they are staying at home or not. So this kind of data we have as well. And then we built a data set trying to track all those, both the deliveries of food assistance and these mobility indicators. So the central finding is that, of course, these food deliveries, once you receive this food delivery, in summary, what you will see, because I don't have not much time, is that the central story here is that receiving this food delivery is going to reduce the likelihood that a household or the people living in those beneficiary households or neighborhoods move too much, right? So this is an important outcome at the time, because you really want to keep people at home, right? So that's the key finding here. So the program was big, relatively big. They delivered 1 million food aid packages around the country, and they were also each food package was relatively big compared to the monthly income of the household. So we expect this food package was going to help in that moment. And then in the study, we use variation both geographically and in time to measure, well, the causal impact. So here I'm trying to illustrate how these deliveries were like exogenously varied by neighborhood even. Those variations depends on just logistics, on when to deliver or not a package in certain neighborhoods. So we use this variation to estimate the effects in a wide range of data on, as I said, this mobile smartphone tracking data, in a wide range of administrative data, just to estimate this fixed effects specification. And so far, what we are finding is that we have a consistently negative effect of receiving in a neighborhood a lot of food packages or grocery packages in this neighborhood. You will see that in this neighborhood there is lower mobility. Out of home events, we have this indicator called here out of home events. This effect is very short time effect. It's just concentrated in the last 2 weeks of it just lasts 2 weeks, and then it waits out. So it's important to say, yeah, it's like this food package. Once the household uses, you have the need again to get out of your home. And the main reason this worked at the time is like we see that the households there in these neighborhoods, they tend to go less to grocery and pharmacy places, and that is how we reduce these mobility indicators. So far to wrap up, the food assistance in this program has effects on mobility patterns, which were not only is not an outcome not only to alleviate poverty, right, in this moment, but also help to contribute to mitigate the COVID-19 expansion. So in a way, has also another effect on public health at the time, right? So, and then, yeah, we can compare whether, compared to cash transfers, at the moment we also have a lot of other programs doing cash transfers, and they did find that they don't reduce mobility as much as we do find here. So sometimes you need in-kind transfers as well in these programs. Yeah, thank you.